Syphilis is a serious bacterial infection. It is usually spread through sexual contact. The bacteria responsible for this illness is called. If left untreated, syphilis can cause very severe health problems. It can affect major organs like the heart and brain. Understanding this infection is the first step towards protecting yourself and your loved ones. Many people are unaware of its potential dangers. This lack of awareness can lead to delayed diagnosis and treatment. The prevalence of syphilis has unfortunately been on the rise in recent years. This trend is a significant public health concern across the globe. Various factors contribute to this resurgence, including changes in sexual practices. It affects people of all ages, backgrounds, and sexual orientations. No community is entirely immune to its reach. Therefore, comprehensive education and accessible testing facilities are paramount in curbing its spread. Historically, syphilis has cast a long and dark shadow over human populations. It was once known by names like the Great Pox. For centuries, it caused widespread suffering and death before effective treatments were discovered. The primary way syphilis is transmitted is through direct contact with a syphilis sore. These sores are known medically as chancres. Chancres can appear on or around the external genitals. They can also be found in the vagina, anus, or rectum. Sometimes these sores can even develop on the lips or in the mouth. This direct contact usually occurs during sexual activity. This includes vaginal, anal, or oral sex. The bacteria can easily pass from an infected person to their partner through these sores. It is important to understand where these infectious sores can occur, because they can be inside the body, like in the rectum or vagina. A person might not even know they have a sore. This means someone can transmit syphilis without being aware they are infected. Sexual contact is the most common route for syphilis transmission. When individuals engage in unprotected sexual activities, the risk of transmission significantly increases if one partner has infectious sores. The first stage of syphilis is known as primary syphilis. It typically begins with the appearance of a chancre. This is the sore that marks the spot where the bacteria entered the body. A chancre usually develops about 3 weeks after exposure to the bacteria. However, this time frame can range from 10 to 90 days. Many people might not notice this initial sore, especially if it is in a hidden location. The chancre itself has specific characteristics. It is usually firm, round, and small. A key feature is that it is often painless. Because it doesn't hurt, it can easily be overlooked or mistaken for a minor pimple, ingrown hair, or a small cut. While there is typically only one chancre, some individuals may develop multiple sores. These sores are highly infectious. Any direct contact with the fluid from the chancre can transmit the bacteria to another person. The location of the chancre depends entirely on where the syphilis bacteria entered the body. Common sites include the penis, vulva, or vagina. Secondary syphilis marks the stage where the infection begins to spread throughout the body. This stage usually starts as the primary chancre is healing or several weeks after it has disappeared. The hallmark of secondary syphilis is a skin rash. This rash can appear on one or more areas of the body. It typically does not itch, which is a distinguishing feature from many other types of rashes. The rash can vary in appearance. It might look like rough red or reddish-brown spots. A characteristic feature of the secondary syphilis rash is its appearance on the palms of the hands and the soles of the feet. Besides the skin rash, other symptoms may also develop during this stage. These can include fever, swollen lymph glands throughout the body, and a persistent sore throat. Some individuals might experience patchy hair loss, particularly on the scalp, eyebrows, or beard. Headaches, unexplained weight loss, muscle aches, and general fatigue are also common complaints. Section 5. The silent threat and severe outcomes, latent and tertiary syphilis. Following the resolution of secondary stage symptoms, syphilis enters the latent stage. Latent means hidden. During this period, there are no visible signs or symptoms of the infection. An individual in the latent stage will feel perfectly healthy. However, the bacteria are still present in their body. This stage can last for a very long time, sometimes for many years or even decades. Without treatment, a person can remain in the latent stage indefinitely, or they may progress to the most severe stage of the disease, which is tertiary syphilis. The latent stage is often divided into two categories: early latent and late latent syphilis. Early latent syphilis is generally considered to be within the first year after infection. During this period, infectious lesions from the secondary stage can sometimes recur, meaning the person can still transmit the infection. Late latent syphilis occurs more than a year after the initial infection, or when the timing of infection is unknown. In late latent syphilis, the person is usually not considered infectious through skin contact, but the bacteria continue to pose a long-term threat to their own health. Pregnant women in any latent stage can still transmit syphilis to their unborn child. If syphilis remains untreated, a certain percentage of infected individuals, roughly 15 to 40%, will eventually progress to tertiary syphilis. Section 6. Syphilis. Within marriage, navigating trust and intimacy. The discovery of syphilis within a marriage can have profound and complex implications for the relationship. One of the most immediate impacts is often on trust. If one partner is diagnosed, questions about fidelity and the source of the infection inevitably arise. This can lead to feelings of betrayal, anger, and deep emotional pain for both individuals. Rebuilding trust requires open, honest communication, and sometimes the help of a counselor or therapist. The diagnosis can shake the very foundation of the marital bond, making it a challenging period for any couple to navigate successfully. Communicating about sexually transmitted infections or STIs can be incredibly difficult, even in strong relationships. There is often a significant amount of stigma and shame associated with STIs like syphilis. This can make it hard for partners to discuss the diagnosis, their feelings, and the necessary steps for treatment and prevention. Section 7. The vital shield importance of early detection and testing. Early detection and testing for syphilis are absolutely crucial for several important reasons. Many individuals with syphilis, especially in its early stages, may not experience any noticeable symptoms. The primary chancre can be painless and hidden, and the rash of secondary syphilis can be faint or mistaken for other conditions. Without testing, a person can carry and potentially transmit the infection for months or even years without knowing it. This silent nature of the disease makes proactive screening a vital public health tool. Identifying the infection early allows for prompt treatment, which is key. Testing for syphilis is recommended in various situations to ensure timely diagnosis. Individuals who are sexually active, particularly those with new or multiple partners, should consider regular STI screenings, including for syphilis. It is also highly advisable to get tested before getting married or entering into a new, long-term monogamous relationship. This helps both partners start their shared life with clear health information. Anyone who notices any sores, rashes, or other symptoms consistent with syphilis should seek medical attention and testing immediately. Section 8. Building defenses, preventive measures against syphilis. The most effective way to prevent the sexual transmission of syphilis is to avoid contact with infectious sores. This means that abstaining from sexual activity is a guaranteed way to prevent infection. However, for many individuals, this is not a practical long-term solution. Therefore, understanding and practicing other preventive measures is essential for those who are sexually active. These measures aim to reduce the risk of exposure to the bacteria. Consistent adherence to these strategies significantly lowers the likelihood of contracting syphilis and other sexually transmitted infections, contributing to overall sexual health. For individuals in a sexual relationship, mutual monogamy can be a highly effective prevention strategy. This means that both partners agree to be sexually active only with each other, and that both partners have been tested and confirmed to be uninfected before entering into this agreement. Section 9. Road to Recovery, Treatment Options, and Living Beyond Syphilis. The good news is that syphilis is a curable infection, especially when it is diagnosed and treated in its early stages. The primary treatment for all stages of syphilis is an antibiotic called penicillin. Penicillin is highly effective against the bacteria. The specific dosage and duration of penicillin treatment depend on the stage of syphilis and the overall health of the individual. For early-stage syphilis, which includes primary, secondary, or early latent stages, a single intramuscular injection of long-acting benzathine penicillin G is usually sufficient to cure the infection. This makes treatment relatively straightforward for many patients. For individuals who are allergic to penicillin, alternative antibiotics may be used, such as doxycycline or tetracycline. However, penicillin is generally the preferred treatment, especially during pregnancy, as it is the only proven therapy to prevent congenital syphilis. It is absolutely essential that individuals diagnosed with syphilis complete the full course of treatment prescribed by their healthcare provider. Stopping treatment early, even if symptoms disappear, can lead to treatment failure and allow the infection to persist and progress. Both the infected person and their recent sexual partners need to be treated. After completing treatment for syphilis, follow-up testing is necessary.